Robotic knee replacement surgery is not about technology. It is about our judgment and accuracy. I'm Dr. Choong Chee Leong. Actually, I've been an orthopedic surgeon for more than 10 years. Well, robotic surgery can never replace a surgeon. We are the driver, we are the controller. Every experience is so important for us before we go into technology. In my hands, I have to know that whether the patient's expectation could be met. Otherwise, it is very difficult to have a painless knee post-operatively. Robotic surgery has a very good accuracy, and hence we can even tailor to multiple angles, because when we do a surgery with a great precision means that we have already measured that this angle can give the patient the best pain-free knee after the surgery. Because robot, we also measure the soft tissue tightness. So that's why everything in the computer system can actually guide us to the correct angle. Actually, the experience of the surgeon is very important. Without that, we cannot adjust the angles properly. We cannot even try to make the angles perfect using the robot. Because precision isn't the machine, it is how we plan, how we position, and how we execute for that one patient. When we choose precision, we are choosing it for every step they take after that.